It's wonderful to be here with you, Dr. Satoshi. This is our first conversation. We'll see where all of this goes. I've been following your work, and I think it's very profound and engaging. But I'm just curious, I would really like to learn a little bit more about you and your origin story and how you came to be a Bitcoin advocate.
Yeah, it's great to be here. Thank you so much for having me. I love watching your content and sharing this journey with you. And I'm really excited that we're doing this. Yeah, I'm a huge Bitcoin advocate. Bitcoin is a huge part of my life. And I'm Dr. Satoshi. I'm an internal medicine physician. I work as a hospitalist, which is an internal medicine physician who manages patients when they're admitted into the hospital. And I've been doing that for about 15 years. And I started Dr. Satoshi Wellness so that I could help people navigate some of the traps that I see with the fiat healthcare system and to help people reclaim sovereignty over their health physically, mentally, and spiritually. And it's been an incredible journey. And Bitcoin has helped me so much along the way. So, a little bit about my history with Bitcoin is I basically went through the same phases as everyone goes through. Michael Saylor says that everyone goes through the same 5 phases with Bitcoin. You first start out as a denier. So you think it's a scam and you have no interest in it. And then you go to skeptic. So your mind opens a little bit. And then you become a trader. So you think maybe there's a way to make money off of it. And then you become an investor. So you realize it's actually a good place to store your money. And then you become a maxi. So you become convinced that it's one of the greatest things in humanity and it can help humanity evolve to the next level. And so through all those phases, and it's been an incredible journey. Yeah. Do you want to hear more about the phases?
Yeah, I'm also curious. So, how long was that period of you going through those 5 phases?
I guess my denier phase was back in 2013, 2014. I remember I had a friend who was telling me about it, and we were at my friend's bachelor party, and he was telling everybody he was all excited about it, but everyone just shut him down and thought he was crazy. So that was my denier phase. And then 2017 is when it had this huge run up. It went from 3,000 up to 20,000 in a very short amount of time. And there was just a ton of hype and everyone was talking about it. So that's when I got into it again. And that's when I first started to put some money into it. But that was my trader phase where I was like, okay, maybe I can make some money off this. I'll get in and then be able to get out with a profit. And, and that's what I did. But then it wasn't until 2020 when I really became more, more interested in it. And they say that Bitcoin comes to you when you're ready or when you need to know about it. And in 2020, I feel like I was ready because my eyes got opened up from COVID. And my major orange pill moment was seeing how the stock market recovered. And it seemed just so artificial and so manipulated. And it opened my eyes to seeing how the system that I thought was more real and something that I could depend on was just so manipulated and really opened my eyes because during COVID, everything basically shut down. And so the economy wasn't doing well, businesses were shutting down. So that's when the stock market went down as it should. But then just shortly thereafter, it just boomed up and was hitting all-time highs. And it just made zero sense at all. And it basically made me question everything I thought about the S&P 500 and stocks and the economy. And the main realization that I came to is that the stock market is just so manipulated. And the only reason it went up like that was because they just printed trillions and trillions of dollars. And that was a mind-blowing concept to me that the government or the central banks could just print money out of thin air. And I always knew that they did that on a lower level, on a lesser scale, but seeing how they did it during COVID was just very eye-opening because I've heard that they basically printed in the last 5 years the same amount of money that had been in existence all the way up until then. So up to 200 years, they printed a certain amount. And then in the next 5 years, they print the same amount. So that basically debases everything that you worked for and devalues everything that you had done up to that point. And
Could you unpack that a little bit more?
yeah,
Like, how does money printing devalue your savings?
so if you work, your work is basically a reflection of your life force. We go to work 40 hours a week, and that's our life force. And we want to be able to retain that with the money that we earn from it. It should be a proper reflection of our life force that we put into it. And when we earn it, we expect it and we really need it to retain its value over time. But if the government and central banks come in and print a bunch of money, it basically makes the money that you have worth less. You have the same amount, but it's not able to buy as much. So your purchasing power gets debased. And so if they print double the amount of money, it basically makes the amount of money that you have worth half as much. And it's very sneaky because you have the same dollar amount. So you don't realize that it actually is worth half as less because they printed twice as much. And that is a really scary concept because it's basically devaluing your life force. It's devaluing you as a human. And it's been going on, and it's only getting worse because the money system that we have now, it relies on being able to print money. And it has rippling effects throughout all of society because subconsciously people know that your money is not going to be worth as much in the future. And so if you know your money is not going to be worth as much in the future, then you're more likely to just spend it and think in the short term as opposed to saving and thinking long term. And so it basically, because the money system is broken, it bleeds into our collective psychology and makes us much more short term focused and less likely to think about the future and think about building things for the future and more about consuming. And yeah, and you could see this effect in every industry. Like in my experience in healthcare, I can see how that endless money printing leads to a broken medical system as well.
No, I think that's a great explanation. I'm curious how you heard about Bitcoin, you dismissed it, you went through the additional phases, and then somehow you're able to link that to broken systems and the medical system that is broken. How did you make that connection, like between broken money and health? Because I know I come from a public health background. I
Mhm.
try to talk to my colleagues, both clinical and non-clinical, about this connection. And as the social determinants of health are major factors that shape your health, and money is a determinant, but yet people are just not making that connection between fiat money, and maybe you want to talk more about what that is, and health.
Yeah, that's an excellent question. And you're right. It's not a connection that you just immediately make. You don't just get Bitcoin and then immediately understand the flaws and everything else. The reason that I was able to see it is because of my personal experiences working in the hospital over the last 15 years. And so I've got an inside look into how the system works and the incentives that drive the behaviors and seeing how the system works. And I went into medicine very bright eyed and naive and thinking that there was this beautiful relationship between the patient and the doctor and that the system was designed to make sure the patient is thriving and is healthy. But what I saw is that there's so much administrative burden, and the hospital system where I work, it needs to make money. And so their motives and their incentives are designed to make money. The health of the patient and the safety of the patient comes second to profit. And that was very disillusioning to me because I knew that our world was run by profit and I knew that's how the business world was and other industries. But I thought that the healthcare industry would be sheltered from that. I thought that people's lives would be more important than money and profit. But it was very disillusioning to see that even in healthcare and even in medicine, profit comes above the health or the well-being of the person. And I see it every day. In the hospital, you can see every single department is getting squeezed to the max to try and extract as much from the workers and the resources. And I've seen it personally for me. Every year, a doctor has to see more and more patients just to have the same productivity as the year before. And every year, more and more administrative demands are being placed on the doctor, more less time. So you have less time to spend with the patient. And the only way to really make things work is to spend less time with the patient. And I see this with every department in the hospital. The nurses, they're having to take on more and more patients each day. And it leads to safety concerns because there's a reason why before you would only have a certain amount of patients to take care of. But because of the system that we live in, this fiat system where you always need to make more and more, then it requires the workers to have to do more and more at an unsustainable level, to the point where it's just I don't see an end to it. We're going to have to keep doing more, and it's going to keep getting more and more unsafe for the patients. And there's no safety mechanism there. It's scary. And it's why I'm so passionate about Bitcoin, because I see Bitcoin fixes this problem that we have.
Yeah, you're so right. Again, coming from a public health lens, we look at like the group data and the kind of the population health impacts. And we look at the economic impact of the fiat healthcare system. Like, for example, in the US, I think it's in 2023, the spend on healthcare was what, $4 trillion? And that equates to maybe shy of about $15,000 per US citizen. And and if you look at some of the graphs of healthcare spending from 1970 to present day, it's like the line just goes up and up and up. And it's like something, as you said, like this is just going to be a perpetual problem if we don't fix the monetary system and the incentives that support this whole system.
Yeah.
Yeah. So fiat, we've been saying that before. I know there's probably going to be the advanced listeners that understand that term, but what does that really mean?
Fiat basically means by decree. And it started in 1971 when we went off the gold standard. So prior to 1971, we were on a gold standard. So all of our money was backed by gold. But in 1971, we went off of the gold standard, which means that the money didn't have to be backed by gold, and it's not backed by gold. So that's why the government and central banks can now print money, and there's nothing backing it. And so it's just paper. And the only reason it has value is because we trust that it has value. But really, there's nothing backing it. So that's what fiat is. That's what we mean when we talk about fiat money. And when we use the term fiat in other areas, we basically mean that the problem starts with that fiat money, the fact that it's not backed by anything, because that leads to a lot of problems where if the money's not backed by anything and you can just print it endlessly, there's no accountability. And if there's no accountability, then people don't make responsible decisions. And it's just not, it basically created a foundation of our society where it's not backed by reality. And when that happens, it leads to, there's something called the Cantillon effect, where people that are close to the money printing will benefit the most. And the people that are furthest away from the money printing will not see as much benefit. And so a lot of the decisions that get made are made by people who are close to that money printer, and their incentives are likely not aligned with the incentives of people that are further away from the money printer. And so a lot of important decisions, like should our country go to war, are being made based on the fact that money can just be printed out of thin air. If there was a finite amount of money and you couldn't just print it out of thin air, we would be forced to make difficult decisions about how to allocate resources and whether we want to go to war or not. But if you can just print it and there's no consequence, then people behave differently.
So I'm curious to know then, what do you think healthcare could look like on a Bitcoin standard then?
Yeah. So Bitcoiners have a term that we say is fix the money, fix the world, because we can see how if you get to the source of this fake money printing and you get back to accountability, then really everything will be better and everything can be fixed. So in terms of health, if you go to a Bitcoin standard, then it basically leads to this decentralized world where you're not forced to get your healthcare through the traditional fiat system. And right now, the traditional fiat healthcare, the model is basically dictated by people who are very close to the money printer. And for instance, Big Pharma, they are incentivized to create pills that people will be on for life. And they're not incentivized to actually make people healthy because they are incentivized to make money, and they make money by people being on medication for life. But on a Bitcoin standard where things are more decentralized, then people are learning how to actually be healthy, not what the system tells them. And when you actually learn what actually makes you healthy, then you can thrive as opposed to be dependent on a system that doesn't have best interest.
No, that's a great explanation. I'm curious, like, based on like maybe the pool of patients that you've seen in the past, what percentage of those patients have like preventable like ailments and issues that you think that if maybe they were able to focus on diet, exercise, those things, they would have been out of the hospital and not in your care?
From my experience and what I see is it seems 90% of the stuff that I see is all stuff that could have been preventable. And this also is being shown in the literature and in the studies as well, that most of the chronic conditions we see are related to metabolic health dysfunction. And a lot of that can be prevented by just basic things, basic prevention. And right now, people are not able to have access. That's one problem. They don't have access to get the prevention. And they also don't have the right information. A lot of stuff that we think about in medicine, we're starting to question now because we're realizing that a lot of the things that we hear are actually coming from, for instance, Big Pharma is motivated to push the curriculum to the medical schools, and Big Pharma actually funds a lot of the medical school curriculum. What we learn as doctors is actually what Big Pharma wants us to learn. So doctors are taught that when someone has a medical condition, you prescribe this pill and they get better. And so doctors have been indoctrinated to think that a medical condition requires a pill. And we've been conditioned to think that these medical conditions are just natural parts of aging. When in reality, a lot of the medical conditions that we see are preventable if you just focus on metabolic health, if you just focus on eating real food as opposed to this ultra processed food that gets pushed, if you just focus on moving and sleeping well, then a lot of these metabolic issues that lead to these chronic diseases can be prevented and people wouldn't need pills. But that would lead to decreased profits. So that the incentives are just not aligned. And when I talk about this stuff, I don't mean that Big Pharma is evil or there's evil people. It's just the incentives are just misaligned. And people are people. So they're going to act based on the incentives. And the fiat system just leads to misaligned incentives, whereas Bitcoin realigns incentives.
Yeah, great points there. Yeah, I think ultimately most people working within the system, like the clinicians, the people in pharma, some of them have good intentions. And I guess we don't want to be bashing the system
Right.
in that sense. But yeah, I think it's the incentives of the money. If we just talk about the money itself and maybe not so much about maybe the people, we can see how people and maybe the systems are just misaligned and don't really promote health and well-being. Yeah, recently, so for example, in Canada, where I'm from, we're up for an election very soon, and healthcare was a topic for the candidates to debate. And a big conversation piece was around the federal funding. While our system is a lot more centralized in Canada than, let's say, in the US, there is a mix of funding that comes from federal and then also the provincial. You can think of the state levels. And the question that was asked of the candidates was around, like, will there still be enough funding? And I guess my question to you is that the right question to be asking? Is it the amount of funding? Because as we talked about earlier, we're spending tons of money on health care. Is it the amount of funding, type of funding, or something else that we should be thinking about when we are bolstering our systems to function economically?
It's not necessarily the amount because in America, we basically spend so much on healthcare, and the studies show that the outcomes are not proportionate to that. So you would think that because we spend so much on healthcare, we should have the best outcomes. But the studies show that our outcomes are very mediocre compared to other countries. So that basically proves that it's not just about money. Money is not going to solve the problem. It's a paradigm shift that's required. And just throwing more money at it is not going to fix the issue if you're still focused on the wrong things and if the incentives are still not aligned properly. So I don't think it's a money issue. It's more of a paradigm shift. And that's the problem, is that when politicians come in, you can't really create a paradigm shift in the short amount of time that they're going to be in office. It can make incremental changes, but it's incremental changes on a broken system. You need a paradigm shift. And that's the beauty of Bitcoin, is that it offers a paradigm shift. It offers this parallel system that you can move on to, that you can shift onto, and it can help slowly move us towards a system that has better incentives and is more empowering for the individual.
Yeah, I totally agree with that perspective. I just wanted to go back around to the lifestyle kind of preventable disease. I think one thing, and I know in your work you really highlight this from the Bitcoin kind of ethos, is something called time preference.
Yeah.
Can you explain that a bit and how that could potentially be improving health outcomes?
Yeah, absolutely. So one of the main things that Bitcoin does in terms of shaping your mindset is it gives you a low time preference. So low time preference basically just means long-term thinking. And it really rewires your brain, because with fiat thinking, you're more pushed towards a higher time preference, as I mentioned earlier, about just wanting to knowing your money's not going to hold its value. So you're more thinking about survival and you're thinking more short term. But Bitcoin, when you know that your money's going to hold its value, it immediately shifts your mind to more of a long term perspective. And and then spills over not just in your finances, but with your health, because health is the most long term thing that you can think of. So there's actually a very strong link between your finances and thinking long term and your health and thinking long term. And when you have this low time preference, you think a lot more critically about the decisions that you're making every day, and the effect that the decisions you make today have on your long term future. So you're more likely to question what you're eating, more likely to make healthier choices, more likely to have better habits. It's very common when I talk to Bitcoiners that they talk about cutting down alcohol significantly because thinking more in the long term instead of that short term buzz that you get, you're thinking more about how that alcohol is going to impact your health the next day or years down the line. And then people realize how important it is to move your body and get physical exercise. Yeah, that is what the beauty, the most beautiful thing about Bitcoin, I think, is how it reshapes your mindset to have that low time preference and to think more long term.
No, that's great. So I have a question maybe for the Bitcoiner that's on the carnivore diet or thinking of going to the carnivore diet. Obviously, we're all individuals, will react differently to different things that we eat, but it seems like there is some merit to a carnivore diet. Do you subscribe to the idea that essentially those that adopt that diet are probably taking out other crap out of their diet, and so their body is able to function better? Or is it something about just centering your meals around meat that is just more health promoting?
Yeah, there's always going to be controversy about what the right diet is, and there's always going to be bad diets. But general main idea is that we we often eat a lot way more carbohydrates than we need, and because it's often pushed, so it's normalized to always be eating processed foods and drinking sugary drinks, and sugar basically has been very normalized in our society, so we don't question it. And I think what makes the carnivore diet successful, what you said, is that if you're focusing more on meat, then you're naturally going to cut out some of the sugar and some of the carbohydrates, and that's a large reason why it works for a lot of people. And I do think that it's a very good way to go. But I think that it's not good to be dogmatic and to push just one diet because everyone is individual. But if you think about your sugar intake and think about how you can cut that down, that's going to have huge benefits for your health because sugar just wreaks havoc on our body. And just because it's been normalized in our society doesn't mean that it should be normal to be consuming it throughout the day.
So I have a follow-up on that. What about fruit? Because that's another controversial one too. And again, it depends on everyone's individual body. But some people I've heard they just completely cut out fruit as well when they're on this, let's say, carnivore diet or a very restricted diet. Is fruit bad because of the potential overexposure to sugar?
No, I think that is an example of people taking it a little bit too extreme because yes, fruit does have sugar in it, but it's a natural form of sugar. And as long as you don't overdo it, it's just fine. And actually, it's good to have a balanced diet. You need to have some carbohydrates as long as you're getting it from natural sources. The problem is that people are just getting this their sugar and their carbohydrates from just ultra processed foods that are just loaded with way more sugar than the body can handle. But incorporating a healthy, moderate amount of fruit, in my opinion, is not bad and I think is actually very healthy.
Thank you for that. Yeah, so I think we're getting close to time here. We have gone over a number of topics. Is there anything else that you want to discuss?
The only other thing I wanted to talk about is just how important Bitcoin is to our world going forward. I think it's so misunderstood right now. People aren't aware of how revolutionary this technology is. And it's not about money, it's not about health, although it is about those things. It's about something so much bigger. And that's what excites me. And that's what so many Bitcoiners see. And that's what we want the rest of the world to see. And that's why I got started making these videos and doing the stuff on Instagram to just really put this out into the global consciousness, just how incredible this technology is and how hopeful we should be going forward because of Bitcoin. Bitcoin puts humanity back on track. And there's so much chaos in the world right now and so much uncertainty. But in a world of all of that, there's Bitcoin. And that gives us a lot of hope. And eventually other people are going to see it too. And it's just so exciting to be a part of this movement and to be alive right now and to be able to share it with people. Yeah, I'm really grateful that you invited me on here. And yeah, I can't wait to collaborate more with you in the future.
Yeah, thank you for the closing statement. I think it's fantastic. I think Bitcoin is just such a gift to humanity. And as you said, like it gives hope. And thank you so much for your time. And it's just amazing, like how Bitcoin is this decentralized like community. Like we were able to connect like via Instagram and
Yeah.
realize that we had a mutual passion for Bitcoin and health. And this is incredible, like the people that you're able to meet. I guess just one thing is that like that person that, is maybe on the beginning of their Bitcoin journey, do you have any words of encouragement and maybe things to point out?
So this is something that's hard for Bitcoiners because once you see it, you just get so excited and you want everyone to see it. But everyone will find Bitcoin when the time is right for them. And what I would encourage people to do is just have an open mind because it's normal to be skeptical of it and to think it's a scam. Everyone goes through that phase, but just know that's normal. But just have an open mind and just learn about it. Just find resources that appeal to you and just spend just a little bit of time learning about it. Because anybody that puts in 10 hours of work learning about it, you never really go back to being a skeptic again. A seed gets planted and maybe you need multiple seeds over time to finally get to the next level. But as long as you have an open mind and you're letting these seeds get planted, eventually you'll see it. And the sooner you do see it, the better your life will be. Everyone's going to find it at some point, and it's going to benefit everybody. But the sooner that you do see it, the better your life will be.
Thank you. I think that's a wonderful note to end on. And just maybe just one quick word, if anyone is listening and is interested in this topic of Bitcoin and health, please comment and let us know what future topics you would like us to discuss.
Yeah, absolutely.
All right,
All right.
great.
Thank you.
Thank you.